Hello everyone, my name is Martin Reck. I'm a pulmonologist and I'm working in thoracic oncology in a specialized lung cancer center in northern Germany in the Lung Clinic Großhansdorf. And today it's my pleasure to talk to you about an opportunity that we have for treatment for patients with advanced non-squamous non-small cell lung cancer. As you know, lung cancer is a very difficult and very frequent disease. When we look on the numbers, approximately 70% of our patients are diagnosed with an age of 65 or older. The majority of patients are diagnosed with an advanced stage of disease. Approximately 60% are diagnosed with metastatic non-small cell lung cancer. Well, when we look a little bit more in detail on lung cancer, in general, we are separating two types, non-small cell lung cancer and small cell lung cancer. And when we look on non-small cell lung cancer, again, we are separating according to the histology between the non-squamous and the squamous non-small cell lung cancer. And non-squamous non-small cell lung cancer represents the most frequent entity, and it's found in approximately 75% of all patients who are diagnosed with non-small cell lung cancer. When we look on the therapeutic opportunities that we do have, in the past years we have treated these patients with platinum-based chemotherapies. And we have reached certain levels of efficacy, but we also have reached something that we would call a plateau of efficacy. So there is an urgent need to improve the efficacy of our treatment opportunities for stage 4 patients with non-small cell lung cancer. Pembrolizumab or Keytruda is an anti-PD-1 antibody, a new immunotherapy, which has shown efficacy across various tumor types and has been licensed across various tumor types. And today I'm going to talk to you about a trial investigating this drug in combination with chemotherapy in untreated patients with advanced non-squamous non-small cell lung cancer. This trial is the KEYNOTE-189 trial. In the KEYNOTE-189 trial, patients with untreated advanced non-squamous non-small cell lung cancer and without oncogenic alteration were randomized between the combination of pembrolizumab and platinum pemetrexed for 4 cycles, followed by a maintenance therapy with pemetrexed and pembrolizumab until progression of disease, or they were randomized to the combination of placebo and platinum pemetrexed for 4 cycles, followed by a maintenance with placebo and pemetrexed until progression of disease. At time of progression, in the control arm, there was the opportunity to a crossover to pembrolizumab when a documented progression could be demonstrated. In the KEYNOTE-189 trial, patients could be recruited regardless of the PD-L1 expression status, which means that also patients with PD-L1 negative tumors were allowed to enter the trial. When we look on the patient's characteristics in the KEYNOTE-189, the characteristics were very well balanced between both arms. The median age was 65 years, and when we look on the geographical distribution, also here the origins were very well balanced. Approximately 60% of the patients were coming from Europe and approximately 30% were coming from the United States. When we look on the PD-L1 expression status, roughly 30% of the patients in both arms had a PD-L1 negative tumor. In the KEYNOTE-189 trials, 2 co-primary endpoints were assessed, progression-free survival and overall survival. When we look on the overall survival, a significant prolongation of overall survival favoring the combination of pembrolizumab with chemotherapy was observed compared to chemotherapy alone. The benefit in overall survival was corresponding to a hazard ratio of 0.49 and to an improvement of the 1-year overall survival rate from 49% up to 69% in the combination arm. We have performed an exploratory pre-specified analysis looking on the efficacy with regard of the PD-L1 expression status. And we have observed that the efficacy was independent from the PD-L1 expression status, which means that there was an improvement in the group of PD-L1 negative patients corresponding to a hazard ratio of 0.59. And there also was, as expected, the improvement in the group of patients with PD-L1 positive patients corresponding to a hazard ratio of 0.47. What about the other endpoints? Well, looking on the second co-primary endpoint, which was progression-free survival, also a significant improvement favoring the combination of pembrolizumab and chemotherapy was observed, with a prolongation of the median progression-free survival from 4.9 up to 8.8 months, corresponding to a hazard ratio of 0.52, and also a relevant improvement of the response rate from 19% up to 48% was demonstrated for the combination of pembrolizumab and chemotherapy. There was also a longer duration of response in the group of patients who received the combination, 11.2 months compared to 7.8 months in the chemotherapy arm. What about tolerability? And this is an important question. When we look on the relevant adverse events, the grade 3 and 4, there was no difference between the pembrolizumab arm and the chemotherapy arm, with a rate of grade 3 and 4 adverse events of 67.2% compared to 65.8%. There was a higher rate in the discontinuation rate of pembrolizumab compared to placebo, 10.4 compared to 20.2%. And when we look on the immune-mediated adverse events, the rate was approximately 23%. The majority of these immune-mediated adverse events were mild to moderate. So, in summary, we have seen that in KEYNOTE-189, a significant improvement of efficacy could be shown for the combination of pembrolizumab with platinum pemetrexed compared to chemotherapy alone. We have seen a significant and substantial benefit in overall survival corresponding to a hazard ratio of 0.49 in favor of the combination of pembrolizumab and chemotherapy. And we also have seen a significant improvement in progression-free survival corresponding to a hazard ratio of 0.52, also favoring the combination of pembrolizumab and chemotherapy. Furthermore, this benefit has been observed across all investigated subgroups, including the PD-L1 negative patients. Looking on tolerability, tolerability was as expected. We haven't seen any new unexpected safety signals. The majority of immune-mediated adverse events was mild to moderate. There have been some side effects where we have to monitor the patients and where we have to look a careful eye on, and these have been the side effects of acute kidney injury and nephritis. Overall, the combination of pembrolizumab with platinum pemetrexed offers, after decades of negative trials, an opportunity for a first-line therapy for patients with advanced non-squamous non-small cell lung cancer, regardless their PD-L1 expression on the tumor. Thank you for your kind attention.